Hafaday, and welcome to our Tourism Townhall Forum. My name is Josh Dekenko. I'll be your host today. I want to welcome you all and thank you all for joining us for this workplace vaccination webinar that we are hosting, brought to you by the Guam Visitors Bureau and the Guam Hotel Restaurant Association as part of a joint effort with the Governor's Office, the Department of Public Health and Social Services, and all the partners that are involved. We also want to give a special shout out and thank you to the Guam National Guard, the American Medical Center, and the Guam Regional Medical City for their efforts to help us with this town hall forum. So let's get started, let's get to it. We want to introduce the Honorable Lourdes A. Leon Guerrero, who will give some opening remarks during this forum.
Half a day. As we work together to revitalize our economy, I encourage the people of Guam to get vaccinated. Our path to have goal is to vaccinate 50% of our population. If we are able to achieve this, we will be able to welcome back our visitors to our healthy island paradise. I want to provide our tourism industry frontliners an opportunity to be vaccinated for your safety and for your peace of mind. I encourage you to ask the panel of experts any questions that you may have regarding the vaccines. We want to alleviate your concerns so we can protect Guam, her people, and her visitors. Let's continue to do our part and support one another, and let's work towards getting some normalcy back to our island. Thank you, and Sidus Masi.
And Sidus Masi to Governor Leon Guerrero for that message. We'll now turn it over to former Governor and President and CEO of the Guam Visitors Bureau, Carl T.C. Gutierrez, for another welcoming message.
Hafaday, Guaho si Carl T.C. Gutierrez, former Governor of Guam and now serving as President and CEO of the Guam Visitors Bureau. We are working to prepare our island to be safe so we can welcome back our visitors and provide them with a wonderful travel experience. But before this can happen, we must first ensure the health and the safety of our local residents. You are at the front line of Guam's #1 industry. That's why I encourage you to take advantage of this opportunity to get vaccinated so that we can continue to protect each other and confidently move forward. We want you to feel comfortable in getting the vaccine. So please ask questions, ask your employers and the medical experts. Let's continue to do our part to support one another. Si Juus Maasi.
And Sidus Masi to President and CEO Carl T.C. Gutierrez. At this time, I'd like to invite the President of the Guam Hotel and Restaurant Association, Mary P. Rhodes, to give some welcoming remarks as well.
Good day, everybody, and thank you for joining us for today's Town Hall Forum. It's really important that we get as many people as possible to go and get their vaccines. We really appreciate all of the time everybody has taken, especially with the government of Guam, the vaccination clinic, to ensure that we have enough vaccines available for our community on Guam, especially the hard efforts of the Department of Public Health and Social Services. We understand that they have already placed an order for their April allocation, and so it's extremely important that everybody do their part, go out, get vaccinated. Today's Town Hall Forum is extremely important so that we can help educate our tourism employees so that when we reopen for the tourism industry, we have a larger percentage of all of our employees vaccinated. It's extremely important from employer side to help reduce our downtime while at work, be able to get vaccines at the work sites should they become available, help reduce cost with absences or illnesses, and also possibly even any hospitalization. So it's really important that people get vaccinated and understand why it's important and the efficacy of it, so that we can really get our employees to feel better, be better educated and more engaged, so that they know exactly why we are getting vaccinated here on Guam. And so we have a unique opportunity being on Guam and having all of these vaccinated. So please go out and get your vaccines. We really want to keep all of our employees and your families safe. And as a community, be able to stand up so that when we reopen tourism, we're all ready to go. So the other thing is we've been able to provide all of our HR managers in the industry. And if you need any information, please know you can contact GHRA or GVB. We do have employer kits available from the CDC. And so we've provided that information. And on the next slide, you'll see from the CDC, the toolkits that we've made available to everybody, including FAQs. All of these frequently asked questions that are available from the CDC, as well as questions made today during this town hall forum, will be distributed to employers so that they have that together with all of the toolkits available to them so that you can help educate our employees. We want to make sure that we provide all of the resources necessary so that we can provide every opportunity for our employees, not only to get educated and engaged, but really get vaccinated. So it's safer to work, safer to go out to our communities, and safer to reopen for our tourism industry. We want to thank again our other partners, not just public health and the vaccine clinic and the reopening committee with the governor of Guam, but also our partners in getting this done with the Guam Army National Guard, as well as the Guam Regional Medical Center and the American Medical Clinic. GHRA has been working closely with AMC and GRMC over the last year with regards to rapid testing and now vaccine clinics. And so it's really our way to stand up the industry and get everybody comfortable as part of our new normal. And so in addition to that, we've also done a lot to educate our employees on the health and safety protocols. And so this is only one of many ways that we can get our employees comfortable with working at the front line as non-healthcare essential workers, because we are all essential and we want to make sure everyone remains safe. So please go out there, get vaccinated. And I'm extremely excited to share the following video of one of our employees who was recently recorded in being able to share her reasons and her point of view of why it's extremely important that you all hear from one of your fellow coworkers on why it's important to get vaccinated.
My name is Chana Villaruz. I work for Hyatt Regency Guam.
And why did you get your vaccine today?
Because it's to protect other people, to protect my family and my workplace, my workmates.
Are you happy that you were able to be given an opportunity to get a vaccine?
Yes, very fortunate because some of the countries or any islands, they don't have the vaccine yet, but we're so lucky here on Guam that they provided us as soon as possible for this vaccine.
How was the process here today?
Very fast. I just log into online, fill up the information, my personal information, and any like history about your health, and then after that, we ask us to fall in line, and then that's it. Maybe not even 10 minutes. We're already here, some nurses assisting us, and then we got a shot right away. Very easy, very fast, and it's very safe as well. We do social distancing.
Are you worried about any of the side effects?
Yes, 50-50. Because some people has different side effects. Their body reacts to it. So hopefully mine will not be very hard for me, like fever, everything. But it's okay. That's a reaction of any vaccine anyway.
Are you happy your coworkers are eligible to get vaccinated with you today?
Yes, I'm very happy that I see most of my coworkers, especially the older one, that they really have needed. And I'm very thankful that the government provide us, Hayat assist us, and then GHRA also is the one who facilitate this vaccine.
Is there anything else you want to add, maybe to people who have not gotten their vaccines yet, how to encourage them or to just maybe allay their fears of why they should get vaccinated?
Well, you don't have to think only yourself. Also, the people in Guam, your family, your kids, your coworkers. So if you have a chance, we all have a chance. The government provide us the vaccine. Let's get it. Don't pass this opportunity.
And then how do you think this is going to impact our reopening for tourism?
Well, if at least 90% of the people, or at least, majority of the people that have vaccine in Guam, it's gonna be a lot of tourists that, if they know that the people in Guam has vaccinated already, they won't get scared to come here. They will feel safe.
And Sidus Masi again to Mary Rhodes for her welcoming remarks and for also talking to Ms. Crona Villaruz on her experience in getting vaccinated and her reasons why. We'll move forward now to our first doctor in our panel of experts that we are thankful that are here today with us. We have Dr. Felix Cabrera. He's the Chief Medical Officer for the Department of Public Health and Social Services. He's able to join us and also kind of help us address some of the questions that we have from our community in the tourism industry with how if vaccine makes a person sick and some other questions that he'll be happy to answer. So we'll turn it over to Dr. Cabrera. How are you, sir?
Very well. Thank you very much, Josh. I appreciate this forum. I think it's extremely important, and the more that we can talk about and speak very, very openly about about how important vaccines are and help answer anyone's questions, I think we always want to take those opportunities. So to get things started, we have some few standard questions that will kind of get the ball rolling here. And if I believe it's the next slide. We'll jump right into it. So here's a standard question that we get a lot is, can a COVID-19 vaccine make me sick with COVID-19? So the plain and simple answer is that no, it cannot. So none of the authorized and recommended COVID-19 vaccines that we have here in the United States or the ones that are currently being developed contain any live virus that can cause COVID-19. That means a COVID-19 vaccine cannot make you sick with COVID. And so there are several different types of vaccines in development. All of them teach our immune system how to recognize and fight the virus that causes COVID-19. Sometimes this process can cause symptoms, okay, like such as fever, but these symptoms are normal and are a sign that the body is building protection against the virus that causes COVID-19. So again, it's like if you're working out and you're training, and if you didn't get sore the next day, then maybe you're not training enough. So it's kind of a thought in that aspect if you just started training, right? And so think of it as your body getting stronger and going through that process. Next slide. So second question is, after getting COVID-19 vaccine, will I test positive for COVID-19 on a viral test? For this also, the straightforward answer is no, you won't test positive on a viral test. So none of the vaccines that are used can cause this and make you test positive on these tests because you don't actually have the live virus and you're not sick with it. So that's the key part there. These viral tests, such as the PCR and antigen tests, only test for current infection or current presence of the virus itself. However, if you're in a situation where you get one of these antibody tests, that kind of it helps us understand your body's immune system and what it's built to fight COVID. And then in some cases, you may test positive here, but it's just conferring immunity for the most part. these are still being studied, and whether or not these tests can be even useful to prove if somebody's fully vaccinated, because there are multiple parts to this, and so it's not something that's going to necessarily be utilized, but it's just something to be aware of moving forward. And so that's the first two questions, and I'll hand it back to you, Josh.
Dr. Cabrera. We'll now move forward again to the next person, the next doctor in our panel that is here today. I'm going to turn it over to Dr. Jeremy Robb. He's the commander for the medical unit at the Guam National Guard. He's going to be helping us answer some questions. For example, will a COVID vaccine protect me from getting sick? So let's welcome Dr. Robb. Dr. Robb, thank you so much for joining us today.
Thank you for having me. Have fun. All right, so I'm going to be discussing a couple of questions. First off, does the vaccine help prevent you from getting sick? Again, sticking with the short and simple answer first, yes, it does prevent you. It does help prevent you from getting sick with COVID-19. So let's walk through this a little bit. Remember what Dr. Cabrera said earlier, that the vaccine is helping your body learn how to recognize the COVID-19 virus. So if you are exposed to COVID-19, you've never experienced it before. Your body doesn't recognize it at all. It has no specific ability to fight it off. It will develop that ability over time, but in the meantime, you're going to get sick, and you might get very sick. You might get hospitalized. You might die. So that's not a great way for your body to learn how to fight this virus. What the vaccine does is it provides your body with the ability to learn what the virus is like, to learn how to make antibodies to that virus, so that when you're exposed to it, your body's prepared. So rather than getting COVID-19 and possibly getting very ill, you have some mild symptoms like fever or body aches, and your body is learning how to fight this virus. And this does two things. One, if you're exposed to the virus, these vaccines work extremely well at preventing you from getting sick, from having symptoms. And they work even better at preventing you from getting seriously ill. So there are some folks, and we can go into this more later, there are some people who are vaccinated who could still get coronavirus, but it's a very small number. And of those who get it, their symptoms are going to be mild. But there's another part of this that's even, in some ways, even more important, because early on people said, okay, it'll help prevent you from getting sick, but it's still going to spread, because we know you can have coronavirus and have no symptoms and spread it. The good news is that more and more information is coming out showing that not only do the vaccines prevent you from getting sick, they also help prevent you from passing the virus, from contracting it and passing it. So that means you're not just protecting yourself, you really are helping to protect your coworkers, your family members and loved ones. And so in multiple ways, the COVID-19 vaccine protects you from getting sick with COVID and preventing you from passing it to others. Next slide. So a follow-up question to that, I'm sure some of you are asking, okay, I've had COVID-19, I recovered, so why do I need to get the vaccine? My body's already been exposed to the virus. For some reason, when we're exposed to different illnesses, our body doesn't always respond in the same way. With some illnesses, we develop really great immunity, and we're not going to get that illness again. If we're exposed to it again, our body fights it off and we don't get sick. And that just doesn't always seem to be the case with COVID-19. Some people who get COVID-19 still get COVID-19 again, unfortunately. And it really does seem that for this illness, the vaccine actually provides better protection than getting sick with the virus does, and it's certainly much safer. Now, that being said, if you had COVID-19 and you were provided with certain treatments, such as monoclonal antibody treatment, you should wait a period of time before getting your vaccine. And I would recommend, if you questions about the specifics of your treatment, and he or she can go through it with you, the short answer, you still get it, because it will provide better immunity from what we can see. And next slide, please. And the last question that I want to just foot stomp on is, what will this cost? it won't cost you. This vaccine is free. The federal government is providing this vaccine free of cost, and the government of Guam is making sure that you have multiple opportunities to get this vaccine. So as already been mentioned earlier, the field house at UOG, a lot of folks are getting vaccinated there. There's multiple public health outreach programs throughout the island, so you can look on their website, look for postings about those. And then many private clinics and pharmacies are also getting the vaccines. And so I would recommend, if you're not sure about your pharmacy or clinic, just reach out to them, just ask them if they have the vaccine and when you could come in and get it. So it's free, and at least on Guam, it's really not hard to get, which, as was said earlier in the interview, we're very fortunate in that we have a good supply and good access to this vaccine. All right, that's all I have for now. I'll hand it back over to you.
All right, Jesus Masi, thank you, Dr. Rob, for answering those questions. The last person and the last doctor in our panelists is Dr. Juan Wen from the American Medical Center, and he's going to be joining us to tell us about how safe and effective vaccines are. So welcome, Hafide. Thank you for joining us, Dr. Wen.
Okay, hi, good morning, everyone. Let me see, you can go to GHRA to the next slide for me. I think, let me see what I'm talking about. Okay, so good morning, everyone. The most common question people ask is vaccine safe or not? And, right now, from the FDA and approval, we have 3 vaccines. You have the Pfizer, and the Moderna, which is 2-shot vaccine, and then you have the J&J, which is 1-shot. And are they safe or not? No, they're very safe. I mean, in the history of making vaccine, there's probably any more vaccine that have been scrutinized heavily by the public, by the CDC, by FDA, and everyone of how safe this vaccine is. So, and they consider very safe, reviewed by many panel, to make sure it's safe with minimal side effect for everyone to have. And so regarding safety-wise, again, we really stress that this vaccine are very safe on certain age group, especially from the Pfizer from 16 years old and over, and then the Moderna and Johnson & Johnson's 18 and over. So on those population, is very safe to have. And if you have any side effect or reaction, there's a website that we all have to be reported to, and we accumulate those things as we go on during the vaccination. And regarding the effectiveness of this vaccine, I cannot tell you how effective they are. The Moderna and the Pfizer are at least 95% or more efficacy, and the Johnson & Johnson are about 72% effective in efficacy. If you talk about vaccine, a typical vaccine is good already if they're 50 to 60% efficacy, just like the flu shot. So when you're talking about anything over 70%, it's a huge amount of efficacy on this vaccine. So they're very effective. The latest data from the Israel study, there's a real data from people that been vaccinated. Israel have about 9 or 10 million people, and they have about 55% vaccinated for the first dose already, and about 44% or so vaccinated for the second dose, the fully vaccinated. And the data come out as, I think this from the Pfizer, and they are 94% effective in preventing asymptomatic infection on the vaccinated personnel. Okay, that's the amount, 94%. On the vaccinated population, they are 97% effective on preventing some the severity of the infection on the vaccine population. So 97%, that's a huge market for that one. And, and regarding people that unvaccinated, they have about 44 times more of when you get infection, you have severe symptom if you get infection rather than people that have been vaccinated. And they're about 20, for people that are unvaccinated, 29 times more risk of dying from the infection of COVID-19. So that's some real world data. You know, you can't. It's not a study. That's a real data from real people. So regarding effectiveness for this vaccine, I can tell you it's very effective, and this is really unheard of before. So that's will hopefully answer the question of people and say that is that effective or not. Okay. Next slide, please. Okay. So after COVID-19 vaccination, yeah, we do have some side effects, and you know, I keep telling my patient that it's really not a side effect; it's a reaction to the vaccine, and you want to know that you have some reaction, because if I get a shot and I don't feel anything, the question is, does it work for me or not? So you know, you want to have something. You know, it can be some mild symptom, or it can be some moderate symptom. And the symptom we see the most out there, at least 50% to 70% people have it, is that they're going to feel some fatigue, okay, some body ache, and some pain of where the site injection is. And that's lasting anywhere from a few hours to up to 2 days, 3 days or so, and they should go away, okay? About 30% of people will have some chills, some fever, some joint pain. But again, those things last up to 2-3 days and they go away. And some people that we see and come into the clinical time is that in the area where they get injection there, they have some redness and swelling. It's not so much pain or itching, it's just the redness, the swelling that they see in the site injection there. That's about 10% of people. But those are a very mild to moderate reaction that you don't need any treatment and you don't need to take anything. You just need to be hydrated, rest at home, and those usually go away. And again, for people that kind of concerned on the side effect, and I keep telling them, if you ask the people that have the reaction or side effect, you know, about a week or 2 weeks later, say, how do you feel? Like, all of them say, I'm back to normal. So that's a very small reaction that you have to have the type of coverage that you have, from like say 95% plus on this vaccine. So those reactions are very mild. There's very few report case of severe reaction, but to my knowledge, there's no one in Guam that end up in the hospital, anything like that at all. So again, those are my reaction that we can tolerate for the coverage of protect yourself, protect the community, and protect everyone around you. So like again, those reaction or side effect is very, very simple, and you can expect it. I tell people expect to have some, but they are short lasting. Okay, next slide.
That's the last one.
Oh, that's the last one. Okay.
Question.
Thank you.
Thank you, Dr. Wen. Very useful information, and thank you for answering the questions. These next two slides, we just want to remind everyone that you can help stop the pandemic by getting the COVID vaccine. You've heard from our panel of experts today, and you're going to be hearing from them during our Q&A session, but we wanted to kind of reinforce to all of you that you have an important part to play in our community in getting the vaccine. And so we want to help answer all the questions that you have so that you feel comfortable in getting that. Next slide, please. And so far, you know, we've all been doing a great job wearing our masks, staying 6 feet apart, avoiding crowds. But the last part that all of us need to have a role in is getting the vaccine. So with that said, we'll move forward to the next part of our forum, which is the question and answer session. Let's bring back our panel, Dr. Cabrera, Dr. Rob, Dr. Wen. We do have some questions from some members of the tourism industry that have submitted these questions to all of you. So I'll throw these out, and whoever is best to answer them, please answer. The first question is, I'm young and healthy and have not gotten COVID as of this point. Why do I need it now? I'll say the question again. I'm young and healthy and have not gotten COVID as of this point. So why do I need it now?
Okay, so as you can see, Josh, on the last year pandemic, for over the past 1 year or so, the overwhelming majority of the young people, anywhere from 18 to 40, they have the highest rate of infection of them all. They are over 50% of the infection that we have here in Guam. And sure, they are young and healthy, which they have very minimal symptom. But again, the reason that they get to get a vaccine now is protect themselves and protect their family. Because usually those are people that have a more social life, and they go out, they get infection and they carry it back to the family. And so if you don't get infection in the past, and as we move forward, you should get the vaccine. Just again, that's the highest rate of infection in that subgroup of the age group. So again, protect yourself and protect your family, protect your coworker. And that's why they need to get the vaccine.
Thank you, Dr. Wen. This is more of a comment, but the person that submitted this is saying, I have many medical issues and taking many medications. We'll lump this together with another question about those with hepatitis B and also with a history of cancer. What would you guys say to the person posing this comment?
So, well, first off, I always recommend that if you have very specific health concerns, talk with your doctor, the person who knows you best. But in more general terms, we know from this past year that the more medical problems you have, the greater your risk of getting severely ill or dying if you get coronavirus. If you have a history of cancer, that's a huge risk factor. And so absolutely, folks who have those kind of serious histories, I would be more asking, what's my risk of COVID than my risk of the vaccine? When we look at those who get the vaccines, Dr. Wen said it's very safe, it's very effective, and there are very limited contraindications to getting the vaccine. Basically, the only reason you can't get the vaccine is if you have a known serious reaction to a component of the vaccine, which is not a lot of people. Not a lot of folks have a history of that. Even if you have a history of allergy, a serious allergic reaction to something else, we simply monitor you longer. And those kind of serious reactions are very rare. But if you have serious health conditions, your risk from COVID is high. And so I would kind of flip that question on its head and say, well, why wouldn't I get the vaccine?
Okay, thank you, Dr. Rob. So this is another comment from one of the individuals that submitted this. It says, I saw in the news that the doctor got the vaccine and then tested positive for COVID.
I guess it's my turn to give an answer here. So, well, the bottom line here is that timing also matters, right? And so, I can't really comment on what we don't know and what the situation was, and he may have, he or she may have had COVID unknowingly and then got the vaccine and then later tested, because the incubation period could be several days. And so that's the most common scenario that we've seen in those who test positive after getting their vaccine. And so that's one part there. But then again, just going back to the other part here is that even those who have been vaccinated, it's practically 100% effective in reducing hospitalizations and deaths. So tell me the story of somebody who was vaccinated and ended up being hospitalized with true COVID complications, and then that's when there will be it would be considered extraordinary overall. But just somebody testing positive after, those things are going to happen, and that's just by pure odds and chance.
Thank you, Dr. Cabrera.
To kind of back up on Dr. Cabrera there, to be fully vaccinated, with 2 doses and then either with Johnson 1 dose, it doesn't mean that you won't get the virus, right? There's about a small percentage of people, about 5% of people or so, you still can have the virus. So to be vaccinated, it will protect you to if you have the vaccine, that you won't have the severe symptom. Okay, you won't end up in the hospital. You're less chance of dying, but you still can get the infection. So the goal here is to never have zero infection. The goal here is to, if you get infection, that you don't get severely sick and you don't get hospitalized. That's the goal. So yes, people won't get vaccinated. There's a chance that you're going to get sick, but it'll be much less. So please still protect yourself.
Thank you. This is another question. What if I get pregnant? Will this vaccine have any effect on my unborn child? And then also, as a follow-up to that, I am nursing. So will this vaccine have any effect on that?
I could take that question, just because my wife and I had that, similar questions that we had to answer for ourselves overall. But first of all, when these studies were first done in these big trials, people got pregnant doing it during the trial. Women, in childbearing years ended up getting pregnant. And so what they've seen from at least that data is that it has been safe for both mom and baby. However, there needs to be more specific trials that look specifically at pregnant women and lactating women who are breastfeeding. And so those are, of course, true questions that we want more definitive data. However, everything about what we understand about the physiology and what these vaccines do tells us that, again, risk versus benefit. The complication of a pregnant woman with COVID is high. And as Dr. Rape said, flip that question on its head, what's the risk of having COVID versus the risk of getting the vaccine? And so it's a personal decision that a woman should make, and ideally in consultation with her doctor. But then that's the same question for breastfeeding. In my personal situation, my wife ended up getting the vaccine and she's breastfeeding right now. And we feel very safe. And in fact, we feel even more safe because now her antibodies are going to pass on to the breast milk to our son. And that's an extremely important benefit that we know occurs. And that's because he's not eligible, of course, for the vaccine himself right now. So that's the short answer to that.
Wow. Thank you for that answer, Dr. Cabrera, and congratulations on your new baby. I also wanted to follow up too with males, right? If the family's trying to get pregnant, and does that affect male fertility, or is that also, do you believe that's safe?
I believe that should be safe. There is no reason for us to believe that at this time. And again, it's also you want both sides to be protected, and all the people in the household that can or that are eligible for the vaccine to get vaccinated as well. And especially if a pregnant woman makes the decision not to get the vaccine, then that makes it even more important for everybody else around her to be vaccinated. I want to make that other point as well.
Thank you. Also, we have a question from Johan Cruz. Are H1 and H2 workers eligible for COVID-19 vaccinations?
So I think the short answer to that is that, if you're a resident of Guam or then you have the ability to work on Guam, then you are eligible for the vaccine. And but there are scenarios where we would like, especially there's large groups of them for it to be organized and of course used through appointment base. But because they are still part of our community, and if they're working here long term, then they need to be vaccinated as well, because they overall do count toward our herd immunity.
Thank you. Okay, so we have a question from Cheeto. She's asking, are COVID vaccines also safe for COVID variants? Do they address those COVID variants?
I can answer that one. So when a virus is in the community, it's constantly going to be mutating. So there are always going to be viral variants, right? So that's a normal thing. What I think this question is getting at is, will these vaccines still work against the variants? So the short answer is yes. These various ways, they code for a portion of the virus. Okay, they code for a piece of protein on its surface and allow your body to make multiple different antibodies to the virus. And so it's unlikely in general that a small mutation or a few mutations is going to completely erase that immunity. Now, there are a number of variants out there, and some of them appear to spread more easily. Some of them may be more deadly, and there are questions about whether or not the vaccines are as effective. But that's kind of a key difference in that question is not will they be effective, it's are they as effective? So they still have efficacy from what we can see. They still work, but in some cases it might not be as high. So this actually goes back to why it's so important for everyone to get vaccinated quickly, because we know that the more virus there is in the community, the more it's spreading, the more variants there are going to be. And so the better job we do of getting people vaccinated so that when one of those more harmful variants is in a person, as they're going around, they have fewer opportunities to pass that virus. And that's a key part of how we defeat a viral pandemic like this is we help reduce the hospitalizations and the serious illness, and then we start blocking the spread. So at this point in time, yes, the vaccines do still work against these variants. Some of them may have reduced efficacy to a certain extent against some of the variants, but as Dr. Wen said, they're so good that even if it's reduced, it's still going to be better than a lot of standard vaccines. And there's no evidence at this point that it's harmful for a person to be exposed to one of the variants after getting the vaccine, just to answer the other part of your question.
Okay, thank you, Dr. Rob. This last question is, do I have to have insurance to go to a clinic for the COVID-19 vaccine? This is from Jamaican Girl. I think we already kind of know that answer, but I'll let you guys answer it.
I think, again, the vaccine are totally free. You know, when the patient come into any clinic or at UOG, anywhere else it's all totally free. You know, there's an administrative fee, but usually that go to the insurance and patient don't pay anything. And all private insurance, Medicare, Medicaid, MIP, they all pay for administrative fee. So patient, really to the patient, the cost is zero.
Okay, thank you, Dr. Wen. This is the last question that we're gonna have for you guys. Is there enough vaccines on this island for our industry workers, and can it be extended to their families, most especially for our workers from the freely associated states, Palau, Saipan, and the RMI?
I think that eventually the vaccine, especially go in May and June, there will be ample supply of vaccine for everyone. I think that if you meet the age of 18 and over for the Moderna in the J&J, and the Pfizer is 16 and over, you will have a vaccine given to you. Yeah, there'd be enough supply for everybody to have the vaccine.
Okay, thank you, Dr. Wen. And that's also tying in with the path to half that our goal is for May to get 50% of our island vaccinated. So yeah, so I want to thank all of our doctors here. I know you're busy and you have patients to see, and we really appreciate the time that you've taken to answer all these questions that the industry has been asking. And I'm sure that they'll have more questions and they'll reach out to their respective doctors and HR teams to get more information. But want to thank you all again for your time. We want to also remind everyone to, you got to protect your workplace as well as your families. And that's a good reason why to get the COVID-19 vaccines. So you heard it from Dr. Wen, Dr. Rob, and Dr. Cabrera of all the different questions and answers that have been posed to them. And the confidence they feel in the effectiveness of this vaccine. So before we close, we wanted to share multiple videos with you of different people that have gotten vaccinated already to make you feel confident that it's happening, and so many of your family and friends are comfortable enough in getting the vaccine. So we'll wrap this up by showing you these videos before we sign off.
Hey, I'm Joe Boss from Hotel Nico Guam, and I'm vaccinated.
Half a day. I'm Marianne Clark from Hotel Nico Guam, and I'm vaccinated. Half a day. I'm Linda Sanchez from Hotel Nico Guam, and I'm vaccinated.
Half a day. I'm Watanabe from Hotel Nico Guam, and I'm vaccinated.
Half a day. I'm Kumari Miyata from Hotel Nico Guam, and I'm vaccinated.
Half a day, I'm Debbie from Hotel Nico Guam, and I'm vaccinated. Half a day, I'm Kaze from Hotel Nico Guam, and I'm vaccinated. Half a day, I'm Winnie from the Hotel Nico Guam, I'm vaccinated.
Half a day. I'm John from Hotel Nico Guam, and I'm vaccinated.
Half a day. We're from Hotel Nico Guam, and I'm vaccinated. I got vaccinated.
I got vaccinated.
I got vaccinated.
I got vaccinated.
Hi, I got vaccinated.
3, 2, 1, go.
We got vaccinated.
We got vaccinated.
1, 2, 3.
I